All right, I'm going to be performing IV insertion and removal skill checkoff. The first thing I'm going to do is verbalize the rationale for IV insertion and removal. The rationale is IV insertion is required for immediate access to the bloodstream to give medications, IV fluids, IV nutrition, or blood. I'm now going to look at my provider's orders. Let's pretend I have a computer. I'm looking at why my patient is admitted. My patient's admitted currently for severe dehydration. The doctor has ordered IV fluids, subnormal saline. So I have the orders and I'm now going to gather my supplies. It makes sense because my patient is dehydrated and their blood pressure is low. This is the supplies that I've gathered. I need a tourniquet. I need a chlorhexidine swab, a 22 gauge IV catheter, a small bore extension set, 8 inches, and you always want to look at your label to ensure that you have the right supplies. I have a 0.9 sodium chloride flush, sterile. All of the supplies needs to be sterile. I've also am looking at the expiration dates. I have a tegaderm, a gauze, we'll pretend my gauze is sterile, and some tape. I've organized it in order of how I'm going to be using my supplies today, so that looks good. And now I'm going to go to my patient's room. Knock, knock, knock. Hello, Alejandro Martinez. My name is Adriana. I'm going to be your nurse today. How are you doing?
I'm doing good.
Wonderful. Before I begin, can you verify your name and date of birth for me?
Yeah, it's Alejandro Martinez, and my birthday is 4/8/1990.
Beautiful. I verified your name and date of birth. Can you tell me if you have any allergies?
I'm just allergic to peanuts.
Peanuts? All right, I won't be having any peanuts today. Are you allergic to tape by chance? Because I will be providing some tape on your skin.
No, everything on the table looks good. I don't think I'm allergic to any of that.
Okay, great. So we've checked your blood pressure. It is a little bit low and it sounds like you've been diagnosed with some dehydration. So I have gotten an order to insert a IV into your arm. Is that okay?
Yeah, that's fine.
Okay. Do you have any questions or have you ever had an IV before?
Yeah, I've had IVs plenty of times.
Okay. Wonderful. So it's going to be in your arm and I'll hang some fluids to get you hydrated. Before I begin, I'm just going to provide some privacy for you. You don't have any visitors, so it's just you and I. I'm going to set up my supplies here. And I'm going to position your arm so that it's in a good, comfortable position.
Sounds good.
I'm going to lower it down a little bit just so we can get some good blood flow. And I'm going to set up my supplies. One thing I'm going to do is I'm going to grab my extension set and I'm going to remove all the air because I do not want to put any air into your arm. And then I have a sterile. And there is water in there, so I'm going to, or air in here, so I'm going to pull back and push out all the air. So I saw my nice bubble there. And then I'm going to connect it and I'm going to flush all of the air out. So you can see that drop there. There is no more air because I don't want to put air into my patient, and I'm just going to set it nicely right there. I'm also going to slightly unscrew this so I can do this, remove it nice and easy. The other thing I'm going to prepare is my tegaderm. So once I successfully insert it, it's just ready to use. So I've opened that. Looks good. I also just want to label this information with my initials, AC, and the date, 4/24/26, and it is 1300. Okay. All right, Mr. Alejandro, I'm going to go ahead and put a tourniquet on you so that I can get find a nice vein on you. I'm going to make it nice and tight. And the way I'm going to do that is by making it nice and tight and then inserting I like to put pressure here and then pull it through so it's a nice easy loop. So I can easily release that if I need to. And now I'm gonna feel for a nice vein. Have you ever had a insertion of an IV with a vein finder or a machine, or are your veins usually pretty easy to find?
My veins are usually pretty easy. They pop out a lot.
Okay. I do see some beautiful veins right here, so I'm gonna go for this one because it's nice and it feels like a nice plump juicy vein. I can feel the bounce and I can feel the spaghettiness. So it's nice and long, and I'm gonna shoot for right here, and I'm gonna cleanse all of that. So let me actually open this too so it's ready, because I don't want to lose sight of my vein. This is Chlorhexidine. It's gonna sanitize and create a nice septic or nice sterile field for me. I'm gonna rub back and forth all over the area that I'm gonna be inserting this IV into. Boop, boop, boop. I'm gonna let this dry, and then it's not best practice, but just in case I need to feel it again, I'm gonna sterilize my fingers here. And I'll put that back. Oh, that's okay. Okay, well, I won't use it again. All right, I'm gonna let that dry. I'm not gonna lose sight of my vein here. If you can see this nice plump vein, again, I felt it and I know where I'm going. This is my grab my 22 gauge needle. All right, I'm gonna make sure my bevel is up. So if you can see, there's a little end piece that's gonna be facing upwards. I'm gonna stabilize it by going in like this. This is how I like to hold my IVs. I'm going to use my thumb to hold back, and I'm gonna anchor the vein. And we're gonna look for a nice, I'm gonna go at a nice, I like to go at 15 degrees because I like to be flush with my vein so I don't go all the way through. And if you saw that beautiful flash, so now I'm just gonna release a little bit and go a little bit more flush. I'm gonna insert 1/8 of an inch, that looks good. And now I'm just going to push with my other finger. And now I'm gonna push my safety mechanism and put my finger here. I'm gonna release my tourniquet. I'm going to go ahead and connect this. And the way you do that is you screw it on nice and tight. I don't know if you can see. And now I'm gonna pull back. Oh, it looks like there's already some. And I'm gonna flush. I got some blood return, so I'm in the right spot. I'm gonna flush. It's flushing beautifully. Okay, beautiful. Okay. And now I'm gonna grab my tourniquet. Not my tourniquet, I apologize, my tegaderm. And I have a little bit of blood that flowed out. I'm gonna pat that dry. All right, and then I'm gonna put this, the way these work is you're gonna put the tegaderm right over your incision site and then connect them together, flatten them out, and then you can pull off one of these ends. It is a mannequin, so I don't think it'll stick very well. And I should be able to see the insertion of my catheter site right there. And this little piece will go here, just right over. And then the part that I labeled with my initials, the time and the date, I like to just put over here on the side so that you can assess and see. So I should be able to assess my site. And now I just want to secure this. That's a good spot. so that my patient doesn't accidentally tug on it. I like to make the tape a little bit thinner, especially because this is thin tubing. And then maybe just one more here so that it's easy access and easy to saline lock. This is how we saline lock. So the circle means that it's open. If we push it this way, that means that it's saline lock and no fluid could be pushed through. All right, I have all my supplies. And that is an IV insertion. All right, thank you so much, Mr. Alejandro. Your IV is inserted. It is currently saline lock. How are you feeling?
I feel pretty good.
Okay, I'm gonna clean up my area. Here's your call light. Your bed is low and locked. Do you have any questions for me?
No, nothing.
All right, I'm collecting all my garbage and I'm just gonna throw that away. Make sure my area is nice and clean. I would sanitize this with alcohol because I do have some blood. This goes straight into the sharp. And then I'm gonna go document that Mr. Alejandro tolerated his IV. I inserted a 22 gauge IV catheter into his upper basilic vein, and that it's clean, dry, and intact, flushing well, and that the patient was left in a safe position, and that I will be connecting him to IV fluids in a little bit. All right, now we're gonna go ahead and pretend that it's been 5 minutes. 24 hours later, Mr. Alejandro has received his IV fluids, and there's now an order to remove his IV because his blood pressure looks good, and he's not showing signs of dehydration, so he is no longer needing an IV. And the rationale for removing an IV is once therapy is complete, there's no need to put a patient at risk for having an IV into his bloodstream. What you're going to need is some tape. Go ahead and pause. I need gauze. So what we're going to need is some sterile gauze. Let's pretend that I opened this out of a nice package, and some tape, and then just some alcohol because sometimes this can stick to a patient. All right, so I'm going to go ahead and remove my gloves because I shouldn't have come in with them. Knock, knock, knock. Hello, Mr. Alejandro.
Hey.
My name's Adriana. I'm going to be your nurse today. How are you doing?
I'm doing good.
All right. Do you have any allergies?
I'm just allergic to peanuts.
To peanuts? Okay, I don't have any peanuts today. I'm actually going to be removing your IV because we are done giving you fluids and your blood pressure looks good and you are no longer dehydrated.
Perfect.
Can you verify your name and date of birth for me?
Yeah, it's Alejandro Martinez, and it was April 8th, 1990.
Beautiful. Okay. First, I'm going to assess the site. It's clean, dry, and intact. There's no edema. There's no bruising. Is there any pain at this site right now?
No, no pain.
Okay. It looks the way it should. And I'm going to go ahead and remove this. It can sometimes get stuck to patients. So I'm going to just use a little bit of alcohol. And that usually helps remove it. And the way that I'm going to remove it is going to the center first, and I'm going to stabilize this so that this doesn't move around everywhere. I'm going to start bundling it up between this finger and my thumb finger. All right, and once you realize that all the tape is completely off your patient and it's all bundled in between the first and the thumb, and you have your gauze ready, I should also have my tape ready. I like to just have a little piece of tape right there. You can also use a tourniquet or Coban as well. All right, Mr. Alejandro, this might feel a little bit uncomfortable. I'm going to remove the IV from you. And I'm going to put pressure right away. Are you on any blood thinners?
Not that I'm aware of.
Okay, I'm just going to hold pressure and then put some tape. Well, first I'm going to see that you're okay. Put pressure for 30 seconds. Okay. And then I'm going to assess my catheter. It looks like it is clean, intact, and none of the pieces are missing. There's no pus. There's nothing abnormal inside of the catheter, which looks good. And it's going to go straight into my sharps. I'm going to dispose of my garbage. All right. Is there anything else I can get you, Mr. Alejandro?
No, I'm good.
All right. Thank you so much. Here's your call light. I'm going to document that I removed the IV 22 gauge catheter from his upper arm basilic vein and that he tolerated the procedure. The catheter was intact, clean, dry, and intact. There's no bruising. There's no edema. There was no complications noted at the site, and performed some hand hygiene. And I've left my patient in a safe position with his call light. Thank you.